Hello everyone, this is Shane, your training officer here, and I've been asked to do a little bit of training on one of the new items that you'll see on our ambulances here at Southwest EMS. This is the Sonotrax Edan Doppler, and it's an audio only device. And so you might ask yourself, why would we have the Sonotrax Edan Doppler on our ambulances? And the reason is pretty simple. Sometimes you may have those patient situations where they're in a low flow state. Maybe their blood pressure is really low, they're hypotensive, or maybe they have a limb that we think may have a deep vein thrombosis, and we question whether or not there's good perfusion to the distal portion of that limb. And Doppler is something that is a really fantastic way to be able to detect and hear pulsatile blood flow. And so that's what we would use this device for. It also has another use with this particular probe. You can see it's kind of wide and flat. This is a 3 megahertz probe. The one that's on the machine by default is an 8 megahertz probe, and you can see that it has a different head and appearance, the 8 megahertz versus the 3 megahertz probe. And so the lower the megahertz, so for this big flat 3 megahertz probe, this is actually for detecting fetal heart tones in an expectant mother. Whereas the 8 megahertz probe is for finding pulsatile blood flow in an artery or in an extremity, or confirming pulses on a patient in a low flow state. So of course the device itself is pretty simple. You have an LCD display, you have an on-off button, so I'm just going to press and release. You can see that we have a full battery, that we have lines where the heart rate will eventually be. It's telling you what megahertz probe you're using. And then the mode selection. Mode 1 is for real-time heart rate. Mode 2 is for average heart rate. Mode 3 is for manual count. Mode 4 is for turning on and off the backlight. So we're going to leave it most of the time in mode 1. And we'll pick up in the next video.